Family Care is a faith-based humanitarian NGO with a presence in over 70 countries. Family Care has carried out medical missions in communities across Nigeria. Each patient received consultation, the medicine prescribed through their diagnosis, and the specialized treatment or surgery they required. Family Care has brought together over 270 doctors, general practitioners, pharmacists, dentists, surgeons, and eye specialists, all gathered to volunteer their expertise over each week-long period, with the ultimate goal of providing health care that can be both immediately effective and lasting.
We are going to have a great time. For the next 5 days, the project will be on course, and as you are seeing this mammal crowd, I can tell you they are all going to be attended to.
This is the first day of the project.
It has been awesome, it has been fantastic.
We've done about 22 cases already. It's just about 3 o'clock, and we have about 8 operating tables.
I just finished a cesarean session, a repeat one for that matter.
We've done about 3 emergency cesarean sections.
Of particular interest, cesarean section, the woman who was brought in this morning, bleeding, her vagina, she had placenta previa, and of course the baby was in jeopardy. Thank God for this program. We quickly went in and were able to do the surgery for her, and she had a bouncing baby, and she's alive now in the ward.
We've been able to carry out almost 80 surgeries up to today, and they've turned out very well. So we believe that God has helped us not only to minister to the physical needs of these people, but to also minister to their spiritual needs.
Family Care!
The last 3 days, we've seen about 2,200 patients. So today we're still seeing close to about 300 this morning already.
Joshua Kempenier is the project director of Family Care. He is enthusiastic about the positive effects of the projects.
On its own, government is having challenges in the healthcare sector, so it's going to take a number of people partnering together, NGOs, corporations, like-minded individuals, to help improve the health needs of the population. We've collaborated with ministries of health, local hospitals, and brought in our team of medical experts. We have general practitioners, consulting doctors who are screening these patients. We're able to do about 800 patients a day, and we've been able to treat all kinds of ailments. From here they get referred to surgery. We also have a dental unit, ophthalmic unit, and optometry unit.
Dr. Soji Ijidale, an accomplished dental surgeon on the board of Family Care, is head of the NGO's dental team. Like many other medical professionals, he regularly volunteers his time and expertise to provide free services to communities in need. Besides his hand-on work, Dr. Ijidale's goal is to make an enduring impact through education and instruction on dental hygiene and health care. After all, an ounce of prevention is worth a pound of cure.
We have done quite a lot of advanced dentistry, like fillings, composite restoration, replacement of teeth, and even amalgam filling. And these are various dental procedures that take so much time. The assistant of emergency should be well equipped.
Throughout the project, Dr. Ijidale conducts educational seminars for the hospital staff and local health officials. The knowledge he imparts on subjects such as hospital-acquired infections is invaluable to patients who often suffer as a result of low sanitation standards during on-site treatments and operations. Dr. Damien Nwaneri, a consultant pediatrician on the board of Family Care, is head of the team of volunteer general practitioners.
We target them.
He also lectures on malaria prevention and control. In a country where malaria-related deaths take a huge toll on the population, education on this subject is vital and creates a ripple effect of information that will save lives.
Not just only free medical care, but health education on malaria. We also had lectures on management of nosocomial infections in our hospitals or in our health centers, to the healthcare workers. Then we also have information on nutrition and other small illnesses, especially that has to do with children, malaria, acute respiratory infection, and diarrhea.
For the medical staff of the host hospitals, the exposure to current trends and developments in healthcare and the expertise of the visiting medical professionals is welcomed and beneficial.
This support that we are getting is free. And if it is free, it means somebody is paying for it.
I'm joining the whole country. Thank you for considering this a very worthy program to implement.
All Libra people are here now from all the 5 local governments together here. Some people are even come from the east and the western part of the state.
The community you're seeing right here today is not just from Kwale. It's from Emu, Ogume, Otagbogbe, Otagbono, all the clans of the Okwani community, and Abe. They are all here. And you can see the crowd you're having. My fear is whether you'll be able to finish these people that are here before Friday. But I think by the grace of God, you should be able to do it. So the impact is superb.
This place is the eye department where we refract and treat other ocular pathologies.
We've seen more than 600 patients, close to 700 patients.
We have given more than 600 glasses to patients.
And a lot of them are quite satisfied.
The family care volunteers endeavor to leave behind a standard of medical proficiency, care, and equipment that is higher than when they arrived. In the demanding environment of the projects, where over 1,000 patients are often treated every day, the learning process for both volunteers and hospital staff is intense and takes root quickly. The donation of medical equipment to hospitals, often using dated and damaged instruments and equipment, is paramount to ensuring a sustainable impact long after the project has concluded.
Beyond just donating the equipment, we've also trained the health workers and hospital staff in the proper use and care of the equipment.
The impact of these donations is beyond measure, enabling both a far higher standard of treatment for patients and allowing the hospitals to move towards more comprehensive health care for their communities.
What gladdens our heart is when you have been able to render help to somebody who otherwise would not have had the opportunity if this kind of a program had not really come into place.
Today, from what they have been doing for the past 3 days now, in fact, it's a great thing that we will never forget. We are very happy. The initiators, God will continue to bless them.
I'd like to say to our sponsors that we appreciate them. We are thankful that they have been able to help us come this far.
Perhaps most importantly, what is left behind each project is a legacy of hope. For the local communities, the visits from Family Care's volunteer medical teams are life-changing occurrences. Simple procedures can have considerable positive and durable effects, not only for the patients themselves, but for entire households.
Ndị ọcha bịara oge ha ga-anakwa njem a ha ga-anakwa n'udo na ọṅụ enwere nsogbu ọbụla.
Eji m oge awa na-ekene ndị ọcha bịara mme ka alụ anyị ọlụ anya na-atụrụ m since 2 years ka anya si tụrụ m adozie ya bụ anya ewere emepụ m ụzọ n'oge awa.
Ana m ekene ndị Family Care, Chineke gọzie ha.
The economic burden on families that must take care of members who are unable to work can be overwhelming in villages where most of the population live below the poverty line. Vision restored, tumors removed, knowledge transferred. In a vast country as diverse as Nigeria, the need might seem overwhelming. But despite the sometimes bleak outlook, hope endures. A family's breadwinner has had his future restored. Parents are no longer forced to rely on the compassion of impoverished relatives to feed their children. Communities can move forward in a virtual cycle of social development. Health is wealth.
I believe that in partnership and collaboration with other organizations, state officials, government, and other NGOs, we'll be able to achieve a lot more.
Thanks to the work of NGOs like Family Care and the sponsorship of socially responsible corporations, we can look forward to a future where statistics in areas like life expectancy and infant mortality will improve from their current alarming levels.
Plateau State is very privileged to have the family care here with us in Plateau State.
Family Care Association is a wonderful organization.
We've never had it so good. The number of operations we've had, the number of medical treatment we've given, the medication we've issued to people, it's never happened.
I thank them for doing this. It's fantastic.
Some people have had problems for 27 years without receiving treatment, so that's a very heavy burden to carry.
They are doing a wonderful job.
The United Nations Millennium Development Goals may still appear daunting, but progress is steady and permanent. The efforts of Family Care through these free rural medical aid projects have touched the lives of many Nigerians and continue to have a ripple effect on countless more.
It's going to take partnership to really make a difference in this country.
And I'm sure that will go a long way to really help to ameliorate some of the health problems in Nigeria.
These days we talk of public-private partnership. This is very encouraging and it's a very good example of it.
They are doing a beautiful job and they should keep up the good work.
So we thank God so much for this project.